Hello, and welcome back to the Injury Podcast. I'm your host, Dr. Craig Salinger, chiropractic physician, and we have an interesting episode today. We're going to discuss something that confuses a lot of people. After someone gets into an accident or they become injured, very often they don't understand the treatment experience, what their treatment should look like, what their goals should look like, and when they're better. So today, what we're going to do is shed some light on this topic. Should we rest? Should you move more? Why does the pain come and go? And how do we know if we're actually making improvement and gains? Today we have on with us in the studio, Dr. Kevin Christie. He is a chiropractic physician here in Boca Raton. He is probably one of the leading sports chiropractors in all of South Florida. He's treated elite athletes, pro athletes, collegiate athletes, has gone to the combine. And I actually met him a few years ago because he's actually coached me. So he actually also coaches chiropractors as well to help them build their practices. Before we do that, I just want to go over a couple of things. This podcast is for educational purposes only. It does not constitute a patient-doctor relationship. Always consult your healthcare provider before starting any exercise or rehabilitation type of program. Okay, well, with that, let's get in. Thank you very much for coming on today, Dr. Christie. I really appreciate it. And kind of going back into the intro of this show, I'm sure as a chiropractor, you've seen this in practice. Somebody gets injured. What do you usually say to them, and what are the first initial phases or of care? Somebody gets injured, they come into your office the next day. How do you explain, educate, and what type of treatment do you start to do?
Yeah, definitely. When someone gets injured, you have to do assessment. And, whether we're talking about a foot and ankle, like an ankle sprain, or we're talking about whiplash, tissue healing typically has a length of time that the research will say that it will heal. And so I'll go over that with them so they understand what they're in for as far as a treatment time, right? And so if they've come to us early on in that, right, say they hurt themselves a couple days ago, they're going to be in that acute phase. If it happened maybe 3 weeks ago, they could have reached the subacute phase where it's still not a chronic condition, but it's not that fresh acute injury. Mm-hmm. And then sometimes, unfortunately, we get to people pretty late, and that's going to be where it might be a chronic situation and the timeline could be longer. But I want them to understand where they are at in that phase. Maybe the grade of the injury, right? So an ankle sprain might be a grade 1, 2, or 3, with 3 being the worst, and what the recommendation of the timeline of recovery is. And then I'll let them know, because I want to educate them and compel them to get treatment and stick with treatment. So I'll explain to them that, if we treat this and you do the rehab and you are diligent with it, we can reduce the time frame of that recovery, get you back to performing at a high level quicker, and then ultimately actually heal the tissue so it doesn't become this underlying thing. Because the mistake a lot of people make is they will get the pain to reduce and the pain can go away, but they didn't actually heal the tissue, so it still becomes an underlying issue that could fester later on in life. So I want them to understand those two key things that we have to do. We can reduce the timeline and get them back, to performing, whether it's sport or life, or even work. And then also we want to make sure we have full recovery of those tissues so they don't re-injure.
Okay, great. So one of the things that I think a lot of providers, chiropractors, physical therapists, get frustrated with is managing expectations, how we manage expectations. And I remember speaking with you, and you had a great educational system that you taught patients different expectations in different areas of activities that they were going to be able to do better, which I think is great. So the patient clearly understands, hey, when can I go back to work? What can I do? What can I do? How do I know if this is working? So can you maybe explain that a little bit on, because I've been very impressed before when I've spoken with you about this, about managing those expectations for patients that are injured.
Yeah, our approach to care will have different phases of that. So like for us, phase one is pain relief. We do want to get them some pain relief and be able to manage it. And then our goal is to get rid of that pain, and that would graduate you to phase two, which we would call return to function, injury resilience, right? Mm-hmm. And that way now we get them off that roller coaster of, okay, the pain is gone, but how do we make sure this doesn't come back in 3 weeks or 3 months? And so that's where we can start to do certain treatments and exercises that we couldn't do when they were in pain, but now we can do to make sure that they are injury resilient. And then once they've gotten to that point and we've returned them to full function and we think all the underlying causes are eradicated, we can then kind of go into maybe a phase three, which would be performance care. And that looks very different for different people. Sometimes that's just working with their trainer or their sports-specific coach, or it's doing a regular fitness routine. It's coming in us to see us maybe once a month or every few weeks for a little bit. And so the performance care is tailored to what their performance needs are. And the thing about performance is it's not only performance in what your results are and what you're doing, again, whether it's work, life, or sport, but it's also making sure that it doesn't re-injure you. And we want to be able to perform at a high level.
Great. Okay. So let me unpack some of this. Yeah. So the first phase would be decreasing their pain, helping them feel more comfortable. The second phase would be getting them to move maybe a little bit
Correct.
Better, able to do maybe certain daily activities that were very painful before. And then third, getting them to get back to performance or some level of higher level of activities of daily living. And I know there's different therapies and different things you use in each one of those type of phases of care. So within that, when you're trying to first get the person just out of pain, helping them feel a little bit better, what are some of the things you use in your office?
Yeah, in our clinic, we have everything from, we do chiropractic adjustments, and we do something called active release techniques, which I've been certified for 20 years now, dating myself for sure. But yeah, I've been doing that, and that's been really good. And then we have modalities, like electrical stim and laser therapy. We do have shockwave therapy also. And so early on, if they're in that really acute, painful phase, we are going to do probably a little bit of soft tissue work. We're going to try to get them maybe a little bit of light stretching, electrical stim, maybe some laser if it's acute. One of the ways I look at deep tissue laser therapy versus, say, shockwave is laser therapy is going to be really good for the acute pain, and shockwave a little bit more for chronic pain. Sometimes we'll do both, but we're trying to get them relief, and there's certain things we can't do at that point. But I think we have a lot of good things in our office to help out with that.
Wow. That's great. So you mentioned a couple of things for some of the listeners out there and viewers that might not know what laser treatment is and what shockwave. Can you explain that a little bit?
Yeah, absolutely.
What it does and how it helps?
Laser therapy, class 4 deep tissue laser therapy, is going to help stimulate the mitochondria of the cell. We're not getting too sciencey there, but it's the powerhouse of the cell, and every cell has the ability to heal. It's just sometimes it loses that tug of war battle with the injury, the stress placed on it, the overuse. And the laser therapy has been proven to stimulate that mitochondria to help the cellular replication, right? Every cell heals and turns over, but sometimes it's struggling to do that. And so the laser gives it a little bit of an advantage to do that. And it's going to help with healing, decrease inflammation, and ultimately pain, because pain is usually coming from a form of either chronic or acute inflammation. Then with shockwave therapy is going to be using sound waves to do that, and it actually helps stimulate stem cells. A lot of people have heard stem cells now with stem cell injections. We're not doing that, but your body has these stem cells, And shockwave uses these pulses, sound waves, to stimulate the stem cells to, again, help with healing and really remodel that tissue. So a lot of times with chronic injuries, which unfortunately, people get these, minor or major injuries and they don't really treat it appropriately, or they just kind of, sweep it under the rug, and it turns into a chronic underlying thing, and you build up scar tissue and tissue degeneration. And so the shockwave will actually help reverse some of that and remodel that tissue and heal it.
So some degenerative conditions too, it could possibly help. Or if somebody's maybe a weekend warrior, middle-aged athlete that plays golf or tennis, basketball, and they have some arthritis in their shoulder, and then they overwork or overexert themselves, and they strain some muscles around that joint, and they have that underlying condition. So are those candidates that you usually would recommend for shockwave too?
Yeah, definitely. I love the cumulative injury cycle, which I'll explain without having the visual that I usually do when I teach this. But active release technique and Dr. Michael Leahy had come out with this overuse cycle. And basically, it starts from having overuse, right? And overuse is happening whether you're sitting too much or you're playing tennis or a lot of golf, or you name the overuse, carpal tunnel, typing, and that'll happen for a while before anything happens. And it's going to then lead to that overwork's going to lead to certain tightnesses in certain muscles and weakness in other. Every muscle in your body has the tendency to become tight or the tendency to become weak, right? So when I say hamstrings, people will say that tends to become tight. Yes. Glutes tend to become weak, calves tight, the abdominals weak, right? Every muscle kind of tends to fall into one of those. It either becomes weaker or becomes tighter. And that muscular imbalance can happen for a while with this overuse. And then it lays down, it's causing this like friction, pressure, and tension in the area, right? So if I use the upper trapezius muscle, which tends to become tight on people, and I'm using that mouse all the time, I'm kind of shrugging that shoulder. Right? I call it the mouse trap. Right? You're using the mouse and it's causing a trigger point in the trap, but you're overusing that area and it's causing a tension and pressure there. And that lays dormant for a while, and it's laying down scar tissue adhesions in that area. And then it's actually going to decrease the blood supply to that muscular area there. In that particular example, it can happen to a muscle, tendon, or ligament. And so now we've got a lack of blood flow there, and that causes the upper trapezius to get knotted up, quote unquote, and it tends to become tighter. So the cycle just runs, and it's really a silent cycle that's happening, and it's getting tighter. That upper trap's getting tighter, more friction, pressure, tension, less blood flow to the area, more scar tissue gets tighter, and then it keeps going until the alarm system goes off, which is pain, okay? Pain and inflammation. So now all of a sudden you got this neck pain or radiation down the arm or something like that. And again, that's just one example of many things that happen. And so what we need to do is reverse that cycle, right? How do we do that? One is we want to reduce the overwork, right? Whatever's causing it, we want to take away that. But then we need to go in and get blood flow to the area, right? So the shock wave, laser, and certain, depending on the conditions, even manual therapy can go in, get blood flow to the area. So now we're getting blood flow. We're getting more oxygen to the tissues. Oxygen transfers via blood or transports via blood, comes to that area again. Blood flow is the key to healing anything. And so now we can reverse that cycle of the scar tissue. And then ultimately through some rehab, we can reduce the pressure and tension in that area. And through rehab, we can strengthen certain muscles, weaken others, and we can really turn off that alarm system and then ultimately fix the root of it, which would be, how do we balance out the muscles, right? Get some good mobility in the tight structures and some stability in the weak structures and reduce the overwork, and we can reverse that cycle.
That's great. And I thank you for sharing that, because this also can help listeners understand when you go to a chiropractor or a physical therapist, there's different modalities or different things they do, different tools to be able to help your body heal more effectively. And you mentioned something before about using the mouse. So we spoke about when most people think about injury, they think about a single event. They fall or they get tackled, or they're in a car accident. And from that single event, they had the pain, and that's what they believe what an injury is. What you're talking about also is there can be mini or repetitive little injuries that happen over time. It could be months, it could be years, and it could happen due to doing a consistent motion or movement continuously. It could it be from posture,
Yeah.
sitting in a bad position for a period of time, working at your desk doing paperwork, things like that. So that is another kind of an injury that is more, it kind of sneaks up on people because it's something that people, when they come into my office, I'm sure yours as well, I ask them, well, what do you think is causing this? How did this happen? Did you fall? Oh, I don't know. It just happened. It just happened a few weeks ago, and they don't understand exactly what caused it, because it's been an accumulation of many years or poor posture, poor repetitive movements over a period of time. And then the body is amazing in that it tries to accommodate. So it still tries to enable you to sit up to do the things you need to do. But later on, the system can break down.
Yes.
And that's when they'll usually come to our office or to their family practitioner or somewhere else. So thank you for sharing that. So then in the next phase, let's say the patient's pain levels are down a little bit, then they get into the next phase, and we're going to have them maybe moving. What are some of the things that you do with patients that they in rehab to help them get better in that next phase after their pain levels are down a little bit?
Yeah, definitely. We're going to continue with the soft tissue work. We might be able to get a little more aggressive to fix underlying causes there. We may move to some what we would call the kinetic chain, right? Sometimes certain injuries are at a particular location. Like we have a saying, don't chase the pain, right? So we might have shoulder pain from overuse, but we find that there's some mid-back issues going on there, and we need to do some joint manipulation or some soft tissue muscle work. So we might hit certain areas that were causing it. And then we're going to, more than likely either ramp up the rehab in our clinic, or they may have an avenue where they're already doing that. We sometimes co-manage with physical therapy, or they got a good personal trainer that they work with, or strength coach. And so we need to also start to work on really strengthening and movement patterns and things like that to, again, fix the underlying cause and make them injury resilient.
Right. And then the last stage before they're ready to go back to their performance type of activities, or get them as close to how they were pre-injury, that strengthening or remodeling, that chronic phase of care that you're doing. And what are some of the things you do in that next phase?
Yeah. Well, and I want to, for a little bit of context, let's just take for an athlete. You can apply this to anybody, but, they have the injury, whether it was overuse or a traumatic sports injury of some sort, a hamstring strain, sprinting or whatever. There's going to be a phase where they are medically cleared, like they're essentially normal. They're doing well, but then can they play a football game, right? That's another animal there. Or the pitcher with shoulder injury pain, can they pitch in a game? That's why if you follow baseball, they talk about having rehab starts. They even will say that. And so throwing for that pitcher is part of the rehab process. And so there's a chasm between, okay, you're medically doing well and cleared, but can you play at a high level in your game? And that middle ground between, return to sport or return to performance sometimes is lost on people, and they don't have a strategy to get there, right? So if you're a runner, we got to get you back to doing some running and testing it out and seeing how you're doing. And if you haven't run in 4 months because of an injury, you can't go out too fast and run too many miles, right? We got to work our way up there. We got to use the running as part of the rehab. So sometimes the sport or the activity is part of that rehab process. And so we got to introduce that back into them. Now, if they're a high-level athlete, they probably have coaches and trainers around them to take them from the medical team to the coaches again and say, okay, yeah, full release, do what you want, right? Now, our regular everyday people that maybe get in a car accident or they play golf, we have to guide them a little bit more there. And unfortunately, I would say so many of them fall off there and say, okay, I'm essentially normal and feeling good medically, but I'm not fully there yet, or I'm not injury resilient, and they don't do enough there. But we got to make sure that we still continue with it. That's why with auto accidents, it's really tricky, because if you're not careful and you don't work through that phase, then you might relapse too often there, right? And so we got to make sure that those patients really stick with it through the care.
Okay, great. So from somebody coming in, having the accident recently, let's say hypothetically they were a car accident,
Yep.
and then they're going to be discharged or on some kind of a maintenance routine, how long does that usually take? That's something that they always ask me, and insurance companies ask us too, right? Doc?
It's a loaded question, right?
It is.
There's no one size fits all. There's no real cookie cutter with it. I think you definitely need, depending on where they're at, you have to have re-exams in there. But if it's let's say it's a moderate, it's a pretty substantial whiplash injury or disc related injury, with auto accidents, it's definitely going to be more into the months than it is the weeks, right? And a lot of times we'll see it can take 3 to 6 months before you're really feeling good about it. Even if you do, right? Unfortunately, the thing that is really challenging with auto accidents for people is sometimes it can be a lifelong thing if it's bad enough, right? And we have to have an expectation on what that's going to look like. Are we going to get full resolution of this, or are there going to be some impairments? When do we know we've reached maximal medical improvement, right? So there's a lot of things that go into that answer. And I think the key to it is having really good communication with the patient and their other providers that they're working with, and seeing, if they're non-surgical or are they surgical. But usually from my chiropractic standpoint, moderate whiplash or disc injury from an auto accident, making sure we get them out of pain or as best we can, and then really working through that injury resilient phase and making them resilient so that, because think about it, going back to our conversation with using the mouse, right? A lot of people can get in a car accident and all of a sudden they have this issue with their neck and they think they're doing better, but they get back to work full time and all of a sudden now they developed a lot of stuff going on because of using the mouse, because they weren't injury resilient yet.
Right.
Yeah.
Right. So, and everybody's a little different. You have people that are older, younger. You have people that had prior car accidents, and that can affect their recovery. It could affect how long they're going to treat. So there's risk factors. And this is something that I hear from patients, but I want to get your take on it. When somebody is treating in your office and they feel pain, is that good or bad?
Like with the treatment?
While they're doing exercises, let's say.
As long as it's okay. Like early on, I'll talk to them about it as okay, you're in a lot of pain just existing in life right now. And we got to work through it a little bit. And I got to be able to treat you through that pain a bit. And sometimes we're going to wake things up a bit, but when the dust settles, you'll feel a little bit better there. And right now, I kind of, I'll joke with them sometimes. It's like, you're a construction site right now and it's not pretty. We're going to make some progress here, and we got to work through that. But I try to really moderate their pain as we're going through it. And so that's why sometimes it takes a little bit longer, because early on, sometimes we can only do so much. And that's where we have to maybe co-manage with some other doctors that can get them some, maybe, medication or something to take some pain away so we can do our job. But sometimes it's painful. If it's a sports injury, and it's a 4 out of 10 pain and it's a calf and the person's trying to run a marathon and they got plenty of time, I'll tell them, look, we're gonna work through this next couple of weeks. You're gonna have some soreness. I'm okay with that, but we're gonna get in there and make some changes to this chronic tissue issue we have here. And so I'll communicate that with them as well. So again, it goes back to the communication with them. And sometimes you have to really back off. And sometimes you have to tell them, we're going to work you through this a little bit and you'll be okay. You'll be sore for 24 to 48 hours, but that's all right.
Right. Okay. One of the other things that I see that happens is patients start feeling good, right? They're feeling a little better. They're in maybe that acute phase. They want to get done immediately. And the minute they start feeling better, they do something. They clean out the garage. They go and they run or they do something they're not ready. How do you, how do you help patients avoid that? And how do you, what do you usually recommend for patients that have been in accidents, maybe not athletes, that have more experience with training and working out, but the person that's in a car accident, what do you tell them and how do you help them avoid situations like that?
Yeah, a lot of times we will go over particular activities of daily living, training, for instance, like lifting mechanics or things to worry about, ergonomics, and then talk about certain things that you can't do right now and movements that are going to be challenging. And again, we try to on the onset is let them know is pain's going to help us guide us, but even if that pain gets lower, you still might be in this phase where you're vulnerable, right? And I'll talk about that kind of vulnerable phase with them where you can't be doing certain things because it could set it back. But I will also let them know is if they are diligent with their care and are doing the right stuff and at home, if they do have a setback at any point, we can typically get them back to where they were quicker, as long as they're diligent with their rehab and treatment. And so I tell them I don't want them to catastrophize if something happens, like, oh my God, I picked up my kid and now it's a 8 out of 10 pain again, and it was a 4 out, before that. It's like, okay, we'll get you back. Don't worry, you're doing all the right things. It happens, and now we know, and so we will talk to them about that as well. But it can be challenging for sure.
Yeah, I find that I think we live in a time where everybody wants things immediate gratification. They want immediate healing.
Yes.
And healing is a process. It's not a single event. So that's very important to know. For someone out there that is in a car accident, how do they pick a good chiropractor if they were doing research, either ChatGPT or they were on Google? What would you advise somebody that wants to get better, and they're either going to go to a chiropractor or a physical therapist, and they want to pick the right one?
Yeah, I think AI search is pretty good now. You can get a lot of that. Obviously we've tended for Google search. I would say my hierarchy of finding someone would be ask a trusted source first. Like if you've got a friend or family member or other doctor or an attorney that you trust, like anybody that you just trust, that you say, is there any good physical therapists or chiropractors? Maybe you ask for 3 good referrals of it, and then you do your own due diligence to pick someone out. But I really like to find that trusted source first that way, but not everybody has that. Or frankly, you trust your own research on finding someone better than someone's referral. So that if you go that route, check out their website, check out their social media. Do they check out some of the content that they're creating? I think physical therapists, chiropractors, other types of doctors should have some content out there so you can get an idea of what their ideas are and thought processes of care, and if that aligns with yours, right? And I think the mistake we make with categorizing auto injury patients is we just categorize them as auto injury patients, right? Mm-hmm. And we just assume they're all the same type of person because they got in an accident, and that's not a demographic or a psychographic. That's just an event, right?
Correct.
So I could have Bob, who gets into a car accident, who's a high-level golfer, and he wants to find someone that's going to help him get back to playing high-level golf. Or I could have, Jim, who's, just a factory worker and wants to get back to work, wants to be able to get back to work soon. Isn't looking for someone like me that works with golfers per se, but someone that has a lot of history with working, maybe with auto accidents and work comp or physical laborers, right? And so I think that's the mistake is just making them, it's just like, oh, they're an auto accident patient. Like that's true. That's an event they got into, but who are they? What are their goals? What are their psychographics, like their values, traits, desires? Are they a weekend warrior or not? And I think you align the type of provider to that that also does have a background in treating auto accidents, because there is a lot to it, right?
Yeah.
There is a lot, and I think you can marry the two things.
Right. Um, I know you've worked with some high level athletes in the past. What are some of the things you see the differences working with a higher level athlete and versus working with just regular people that are not elite athletes?
Well, so let's take the high level athlete versus a regular person. Ultimately, more than likely, the elite athlete, it's their job, and so it's a job for them, or they have aspirations of it being a job. Maybe they're a college athlete and they have a chance of being a pro athlete, or they're a high school athlete and they have a chance of being a college athlete and beyond. And so in that realm, it's a job, and they're looking to get back to performing at a high level of job, just like the regular person is. Now, certain sports definitely have a lot more physicality to it. And so when you're working with them, if it's a high level athlete, you're going to more than likely, I would say one of the overarching differences is you're going to be communicating with other performance and health specialists, right? So if it's an elite athlete, you might have to communicate with their coach. You might have to communicate with their team. You might have to communicate with a sports-specific trainer or even an athletic trainer, or they have a head orthopedist, right? So there's going to be a team approach around that person. And we really got to get crystal clear on the return to sport timelines there, right? So that's why you will see them get all the treatment and imaging and assessments and everything, because they're trying to figure out, can this player play next week or next month? Whereas a regular person, we don't have to be as crystal clear on the return to work or life timeline. We want to still have that, but it's not as much. And you might be just having that one-on-one communication with them versus the team.
Yeah, absolutely. Have in terms of working with people that are in accidents, and it seems like some people in accidents, they re-injure themselves over and over again in kind of the same areas. And I know we spoke about this a little before. Do you think that there are people that go to physical therapists or chiropractors and maybe they just don't follow through with the treatment programs, or they don't get to that strengthening phase where they're doing work to strengthen and stabilize these muscles? Because it just seems awfully that there are people out there and maybe they're just checking out or they're discharging themselves once they start to feel a little bit better. Because I see that a lot in my office, where somebody might have had an accident a year ago and they stopped treating, and then a few months later, maybe their claim and everything had been settled, but they continue to have this re-exacerbation periodically.
Yeah, I mean, you kind of nailed it, right? So they might use pain as the line of demarcation for success or discharge. And so they feel a little bit better, pain is mild or gone, but they never healed the tissues and then strengthened the tissues. And so you mentioned strength. That's a big missing component. So they stop care and they're feeling a little bit better, but they didn't really heal the tissue. And then B, even if they did that part, maybe rarely they go through the strength and loading of those tissues, right? So you got to be able to load those tissues and strengthen them, like tensile strength of it, so that it can then go and handle going back to the regular gym, or doing CrossFit, or if you're a cable layer and you got a physical job, or frankly, again, going back, if you got cervical whiplash and you have a desk job, it's gonna be hard to sustain it. Even though it's not a high load sitting, it's a repetitive load, and your head's forward, and it causes a lot of issues there. And so not enough people follow through past the pain phase into tissue healing and then tissue loading to make it strong and obviously resilient.
Yeah. And I think there's several reasons for that. I think, unfortunately, in our system with insurance carriers, insurance companies, once pain levels are low, they are very anxious to get the patients out of care and not wanting to cover any more treatment. So that's important. So if the other thing I think is interesting is an athlete, I think, can be more in tune with their body because they're testing their body at a higher level. Whereas someone that is sitting behind a desk and they're middle-aged, they might not be playing. They might be going to the gym periodically, doing the same amount of weight lifting that they did before, or they might be sedentary. A lot of people are sedentary and they might not be testing their body. They just might feel a little bit better. And so they don't have, because they're not testing their body. When an athlete tests their body, like, oh my gosh, my back is still hurting a lot, they know they're not ready because they cause, maybe by sprinting or doing an activity, or they stress that tissue, they feel it's not strong enough, or they feel a little bit of pain. They know that they're not fully recovered. Mm-hmm. But how would somebody, or could they know, okay, I think I'm ready to be finished with care, or they're starting to get to that point? For a patient out there, what signs would they kind of experience that they're okay, I'm getting better, I'm almost stable? Because we know as providers, there's different assessments we can do. There's different ways that we can gauge that they are ready to be discharged. But for the patients, so they have the understanding and they know, okay, I'm ready to be discharged, not just the pain is gone. Because that's so frustrating for so many providers, because people end up chasing the pain. They wind up taking medications. They do everything just to get rid of that, but they don't get strong again.
Yeah, definitely. And obviously with the athlete, they do have that feedback system in place and they can go and test it. But yeah, if I'm working with an athlete, I want them to go back into the activities of that sport, right? If they're a golfer, I want to have them, use the pitching wedge and the 9-iron for a little bit for 20 balls. How do we feel there? Good. Let's work it up there. And while you're healing, work on your putting and chipping. You can be even better, right? Mm-hmm. So we can use the sports activities or the sport as an assessment of how they're doing. Obviously, there's certain things in our office, like you mentioned, that we would do before we would even have them attempt that. But then, like if you got a regular person that's not an athlete, we got to break down certain things that they have to be able to do, right? If they have certain lifting things they have to do in their job, can we test that?
Like mimic that work environment?
Mimic it, yeah. If they like to walk, 30 minutes a day, okay, let's start with 10. How did that go? Come back. Oh, it was fine. Okay, let's do 15. Okay, good. 18 didn't feel good. Okay, let's stick at 17 right now. 17. Okay, now let's try 20. Oh, it was good. Right? So you use that activity as a test, but they have to be willing to do it on their own, because I can't. I mean, I guess I could, but we're not set up in our office to have someone walk for 30 minutes to see if they can walk for 30 minutes, right? Or sit at a desk for 7 hours to see if they can sit at a desk for 7 hours. So they have to do it on their own, and we give them the guidance to do it. And so if sitting's the problem at the desk, we say, okay, how about a sit to stand situation for a little bit, or more frequent micro breaks and walks around the office, and we try to work to meet in the middle there.
One of the things I do in my office is I have a sheet that is a pain diary. Mm-hmm. So for my patients that have been in accidents or trauma, what we'll do is we'll have them daily, if they can't do it daily as often as possible, they'll go through different activities, sitting, standing, walking, and a whole list of different 8 activities of daily living. And then they'll check off, am I having pain that day doing this? Or how long did I have pain for? Did the pain start to happen after I was sitting? So if they're doing that daily, then it's a better gauge. It gives us a little bit more data. So if the person's not necessarily an athlete, we can gauge, well, are they getting back to where they were before? And then be able to have a better idea of when they're ready to be discharged. Or maybe we have to do more strengthening. Maybe we have to do more core strengthening, or we have to do some other type of modalities to get them to that next level. In your practice, I know you practice here in Boca Raton. What are some of the things you do in your practice? What's new? What do you do different than, let's say, other chiropractors that don't do sports chiropractic?
Yeah, we you walk in our office and we got a big open rehab area. It's rubberized flooring and it's pretty good size. And we've got therapy tables in there, but we also have a squat rack in there. We've got
Nice.
free motion machine and kettlebells. We have a tonal gym, if you're familiar with that. Tonal Fitness was designed for at-home fitness, and it uses digital. It's kind of like if you think about, you got the bike. What's the
Peloton?
Peloton? Yeah, the Peloton. This is like Peloton, but for strength training. And so it's got a screen where it's showing you and how to do the exercise. And we've got that built onto the wall. And so we use that for our rehab and fitness in our office. We've got, we got 2 doctors, and we're both certified in active release technique, which is a really good soft tissue. It's really good for whiplash injuries as well. A bunch of the NFL teams have ART providers on there, and so I do that. And then again, like the shockwave and laser, and chiropractic's still a big part of what we do.
Right.
Kind of the bread and butter.
How important do you think in your practice, in your sports chiropractic practice, that people, let's say they're in high school and they want to be collegiate athletes, or they're collegiate athletes, they want to get to the next level. How important is it for somebody to go periodically to a chiropractor such as yourself to get checked? Because they might have a small injury and they might just shrug it off, but that small injury might turn into something that could affect their play and their future as an athlete, or even if they're like to play golf or tennis and they're not professional, but they want to do that better. Can you speak to that a little bit?
Yeah, absolutely. I think, one of the things I'll recommend to those athletes, I'll kind of give them an analogy. It's like if you were a pro athlete and you were, playing for the Atlanta Braves, like how often do you think you're getting body work done, right? So I'll kind of frame it as body work. And it's like, oh, probably all the time, and it's like, yeah, you would. You'd have massage therapist, probably a chiropractor, maybe an acupuncturist. You'd have the athletic trainer on the team. Like your body is your equipment and your tool. And so you got to really keep up with it. And so I'll give them that analogy. It's like, yeah, the pro athletes are doing that. And obviously the pro athlete will have a little bit more, they got more financial resources and more resources in general, but there's no reason why a collegiate athlete or a amateur athlete, a high school athlete, junior athlete, can't have that also. So I want them to design a local bodywork team for them. It doesn't have to be crazy. You don't have to get a massage every week. You don't have to go to the chiropractor 3 times a week for maintenance care, right, or performance care. But having someone that, maybe a little bit of a team, 1 or 2 or 3 people that get to know your body and your sport and all that, and rely on that expertise to help you stay healthy and then put out any fires if they happen.
Okay, great. Well, if people want to learn more about what you do in your practice here in Boca Raton, how do they contact you? What should they do?
Yeah, absolutely. You can find us at healthfitchiro.com. You can call us at 561-997-8898. And we do a pretty thorough assessment, figure out what's going on there, and treat everybody from athletes to regular people to auto accidents.
Great. And you also have a lot of content that you provide for runners, right, and different athletes. So if they want to learn more about how to avoid injuries and how to be able to do some different things that can help them recover faster, you have information like that as well, right? How do we find out about that?
Yeah, absolutely. I would say, we consider ourselves, what we try to consider ourselves as a leading educator in health and performance in our community. And we've been creating content for probably 12 years now consistently. Dr. Gage Winkles, who's one of our doctors, is really taking the reins of that now and creates a lot of content. Our Instagram is pretty active at HealthFit Chiro, and YouTube channel, again, HealthFit Chiro. Everything's kind of branded the same there. And we just put out a lot of good health and performance educational content that people can follow.
Love it. Love it. All right. So before we finish, we have a ritual at the end of the show. We do something a little different. Recovery requires a mindset. You need to have grit. You need to stick with it. And with that, we've give away a superhero tumbler because to us, they embody that comeback mentality. So behind you, I have a whole bunch of superhero tumblers. And I actually have another one that is not here right now. It's back in the office. I forgot it. We also have, sometimes we'll have some university tumblers as well. I know you're a big Florida State guy.
Yeah.
And we have one too at the office. So which tumbler, the Florida State or one of the superhero tumblers speaks to you the most now?
I'll do my Incredible Hulk here.
Awesome.
My kids will love it too.
Great.
Thank you.
That's awesome. Well, thank you so much for being on the show today. Really appreciate it, Dr.
great.
Christie. And if you guys want to learn more about Dr. Christie, we'll have the information in our show notes. Again, thank you for tuning in. And let's all get strong again. Like I say at the end of the show, like, follow, subscribe. See you on the other side.